Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call, and we want to hear from you. In more than 500 episodes since March 2020, we've been bringing you the latest on urgent public health topics like COVID-19, climate change, gun violence, monkeypox, racism, and more. We'll continue to cover these, but we'd like to know, what other public health topics would you like to hear more about? Plus, you can enter to win some amazing podcast swag, including the beach tote featured on our Twitter account. Please go to publichealth.jhu.edu/publichealthoncall/survey to take a brief survey of potential future topics. This will be open until September 9th, and that link is publichealth.jhu.edu/publichealthoncall/survey. We're excited to hear from you, and thank you so much for listening. Today, all about airplanes and COVID. Dr. Mark Gendreau, the Senior Vice President and Chief Medical Officer of Beverly Hospital in the Greater Boston area, speaks with Dr. Josh Sharfstein. Dr. Gendreau is an emergency department physician who has studied infectious diseases and aviation. He's got some great advice for air travelers. Let's listen.
Dr. Mark Gendreau, thank you so much for joining me at Public Health on Call. You have been interested in infectious diseases on airplanes for a long time.
Yeah, a good number of years.
Why?
I grew up in an Air Force family, so flight was always an interest to me. When I finished my residency training and got a job, an academic job at Brigham and Women's Hospital in Boston, I needed a research interest. And I noticed that there really wasn't a whole lot written or studied about with respect to in-flight medical emergencies, which was right up my alley. And then more importantly, infectious disease transmission aboard commercial aircraft.
So before we get into COVID, let's just talk about infectious disease on aircraft generally. What's the big picture here?
Yeah, the big picture is that air travel is safe. Your risk overall to get an infectious disease is quite low, with a big caveat that the ventilation system within the aircraft is properly functioning. I like to say that if you have a properly functioning ventilation system on the aircraft, that it is better ventilation than what you will get in an operating room with respect to more air exchanges per hour, compartmentalizing the airflow into anywhere from 4 to 8 sections, depending on the aircraft that you are flying on. And the ventilation systems were really well designed many years ago, primarily because back then you could smoke when you flew, and a lot of people smoked while they were doing air travel. I remember it, getting on aircraft as a kid and seeing a lot of people smoke. And so they wanted to be able to have a very efficient ventilation system that would clear that cabin of the odor and of the smoke from tobacco products. So it was a really well-designed system.
I didn't appreciate that at all, but it makes sense. Now, despite that, there have been some cases of serious infectious disease being transmitted on airplanes. They wind up in papers. Sometimes when I was a medical student, got to read them. What are the classic examples of transmission?
So, there's been reports of measles transmission, tuberculosis, particularly laryngeal tuberculosis. There's many forms. There's been influenza, you name it. There hasn't been a hemorrhagic viral outbreak on an airline. There's been individuals who have flown with Lassa fever and Ebola. And thankfully, none of the fellow passengers that were exposed to the passenger with those infections ever converted, which was fortunate. We've seen SARS back in 2002, 2003, the famous Air China Flight 112, which was a super spreading event. And then with respect to the COVID pandemic, there's been a number of published studies, very well carried out epidemiological protocols studying this of transmission aboard commercial aircraft.
All right, well, I'm going to ask you more about COVID in a second, but last non-COVID question. In a lot of these outbreaks, what we're not seeing is the entire plane getting infected, right? It's usually the people who are sitting closest to the person who's coughing or infectious.
Right. The way that the aircraft is designed is that the ventilation system is what we say compartmentalized, meaning there's, typically you're going to be having the same air as people who are about 4 to 6 seats in front of you, 4 to 6 seats behind you. So depending on the size of the aircraft, you're going to get, anywhere from 2 to 8 different ventilation sections within the aircraft. So, if you're sitting way in the back and you're hearing someone coughing and blowing their nose and, they're about 8 rows in front of you, you're not breathing any of that air that passenger is breathing. The only exposure that you will have is if you're moving into that area to use the restroom, or if there's a flight attendant who comes into your space and it is an infectious disease that can be quickly sort of picked up by that flight attendant and carried into your airspace compartment.
So now let's talk about COVID. You mentioned there are a bunch of studies. What do those studies show?
So overall, when you group all the studies together, the overall risk of transmission, if you have a COVID positive individual on the aircraft, ranges anywhere from 0.2% to 4%. So, a broad range, but overall still quite low. And that includes even individuals who are seated fairly close to the index or the individual who is infectious.
So there has been documented transmission. It's usually for people who are pretty close, and even then, it's somewhat rare.
Right.
Now, what about the other aspects of air travel? Is your interest limited to when the flight is at 40,000 feet? Some of us who've been going back to airports are pretty impressed by the conditions, say, of a crowded jetway going to the aircraft or coming off the aircraft or the boarding areas. Do you think that there's more risk there than in the airplane alone?
Yeah, this is actually being studied by the National Academies of Science. I was on one of the panels for the Academy, and we specifically supervised a study looking into this where we wanted to kind of understand where are all the, what we called the infectious choke points during the continuum of travel from sort of as soon as you enter the airport to the time that you get on the aircraft, disembark from the aircraft and whatnot. And that project resulted in a publication that was directed at airports and air carriers to give them guidance as to where are these choke points, what are the best practices to mitigate this risk. The biggest choke points are in security line. Why? Because that's a very crowded area. People are, lined up close to each other. Sometimes in busy airports, you're very close to people for a long period of time. And so it is a risky area within the airport. And particularly when you go to an airport with COVID, and you're standing in that line for a long period of time, and you're not taking any precautions like wearing a mask and making sure that your hands are sanitized before you touch any of your eyes, nose, or your mouth. The second seems to be as you're boarding the aircraft and as you're disembarking from the aircraft. And out of those two, the highest risk is getting off the aircraft. And the reason why getting off the aircraft is risky is think about the last time you traveled and, you taxi up and then you hear the ding and like 180 people suddenly get up and crowd the middle aisle, start getting their bags out of the overhead baggage. And then it's dead quiet for a few minutes when the engines shut off. And the reason why it's dead quiet is that air crew is hooking up the auxiliary power unit so that the ventilation can continue. Because when the engines are turned off, there is no circulation. So the sooner that auxiliary power unit gets activated and returns on that ventilation system, the safer it is.
I'm learning a lot here. I really appreciate that last point. When your plane turns off, the ventilation turns off and the risk goes up. So let's just imagine I'm a traveler who's not that excited about getting COVID, along with my free drinks and snacks on the plane. What do you recommend?
Always bring a hand gel sanitizer. I would recommend wearing a mask in the airport, at least while you're getting through security and when you're getting on the aircraft and when you're getting off the aircraft, or if you're moving to go to a restroom. If you're sitting in your seat, you should be fine. The other thing you can do is to turn on that air gasper. And what that does, you don't need to turn it on full blast. That would be quite uncomfortable, but just turn it on slightly so that you can kind of feel a little air movement if you put your hand out a little bit in front of your lap. And what that should do is help just give you additional ventilation at your seat in addition to the ventilation that's already occurring in the aircraft cabin. And then just practice really strong hand hygiene, particularly when you return from the restroom, because there's been issues with contamination of aircraft water. And if you touch any surface above, like if you get up to get, something from your overhead luggage or bag, things of that nature.
This is what I would call news you can use. Thank you so much, Dr. Gendreau. This has really been terrific. Really appreciate it.
You're welcome.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.